Good morning, good afternoon, and good evening from wherever you're joining us from. Really grateful to have you here today. My name is Dr. Jemimah Kariuki, and this is Wills for Life by Dr. Jemimah. So today I want to tackle an issue that affects very many women, from 25 to 50%, depending on how old you are, of the women are actually affected by urinary tract infections, or what we call UTIs. And one or two infections here and there is not an issue, but it is when you have recurrent UTIs that then we get concerned. So when we look at who is affected by UTIs, really below the age of 1, which means the infants that you have at home, they can get urinary tract infections, about 1 to 3% of them, usually because of the hormones of the mother that are still running in them. And then from 1 to about 15 years of age or below puberty, only less than 1% actually get these infections, and issues could stem from that. It could stem from sharing washrooms, but majorly because they don't have so many hormones and their pH is at a stable state, they tend to not get recurrent infections unless it's coming from contact with, for example, poop or E. coli from stool. But as you get between the age of 15 and 20, which are our adolescent age, then as the hormones peak, there's a change in vaginal pH, and that results in a resurgence or an initiation of getting urinary tract infections. Above the age of 20, we see them more commonly, because of pregnancies, and UTIs are so common in pregnancies. And then we also see them because of multiple sexual partners or just sex in itself. So that is one of the things that can cause urinary tract infections in the younger population. As women grow older, and we celebrated World Menopause Day the other month, one thing that we see is that because of the drop in hormones, the vaginal muscles and the perineal muscles actually loosen or weaken, and we start seeing things like cystocils that can actually predispose these patients or these ladies to recurrent urinary tract infections. So as they grow older, above 60, 80, and chronic illnesses start affecting them, you may find that because of issues such as spinal cord disorders, neurogenic disorders such as diabetes mellitus, then infections become more common. So, and then we also have catheterization, actually, especially above the age of 80. For one reason or another, they may become bedridden, or they may require the assistance of a catheter for monitoring of other illnesses, for example, acute kidney injury or stroke. And with all that, then those catheters become the source of infections if not changed frequently. So that's what we're going to be dealing with today. And as we resume, we're going to be tackling symptoms to check out for and see them. So why do we as women get more urinary tract infections? There are many factors, but the most important is that our urethra is short compared to that of the male. The urethra of a female adult is 4 centimeters. 4 centimeters is about the length of this finger, if I take up to somewhere there. Compared to a male, who the length of the urethra is the length of the penile structure. So it could be 6 centimeters, 8 centimeters, 10, 15, depending on the length of the penis. So because of that short length, then one other thing that affects us as female is that the lower third of that 4 centimeters is actually encroached with bacteria. which are non-pathogenic when we are younger. So this bacteria, if the balance is not okay, then they can grow further to actually ascend and give you an infection. The other thing is that the urethra, the vagina, the vulva is the area around the vagina, and the anus are about maximum 4 to 5 centimeters apart. So this can actually make you get more infections as a predisposing factor. Why? Assuming you have shared a washroom, for example, and some of that water splashed on you, you can see the distance to get to your urethra is very short. And most UTIs that actually affect women are the ones that get to the bladder. So when you look at infections of the urinary tract, we look at the lower urinary tract, which is a urethra, something we call urethritis. We look at the area of the bladder. So you can get an overactive bladder, or that will give you other things like incontinence. But that area of the bladder, if it gets a lot of pathogens growing, then you can end up with an infection. Then the higher up urinary tract is now where the kidney come in, where the ureter come in, where the kidney stones would affect you, and also have their own types of symptoms. So that is why as women we are advised that anytime you want to wipe yourself, you have to wipe from front, which means urethra, going to vagina, going to the anal area. Why? The bacteria of the urine are not likely to affect the vagina, are not likely to affect the anal region, but the bacteria of the anal region are very likely, in fact 90% of the time, can cause a urinary tract infection, which we call E. coli. So most times when you do a culture, you find that E. coli is growing in the urine, and when we know that, it's contamination from the fecal matter. Okay. So in pregnancy, I mentioned that in pregnancy we get more urinary tract infections. And why is that? The baby puts pressure on the bladder, and that pressure on the bladder causes a delay in urine passing out. So there's more time for bacteria to grow within the bladder. So when that happens, then the bacteria now become a colony, and then that colony keeps growing, and then now it gives you an infection that goes up into the renal calyces via the ureter and gives you things like pyelonephritis or pus in your kidney. It can now go down towards your urethra. And then the other thing is, because of the hormones of pregnancy, then the sensitivity of the uterine muscles or of the bladder muscles is not as strong, and therefore that laxity also predisposes us to more urinary tract infections. So how do you know that you have a urinary tract infection, or what are the symptoms of a urinary tract infection? When you look at symptoms, you have to look at it as a two-pronged matter. Is it on the lower side, or is it above the bladder? So if it is on the lower side, and what women mostly complain about, then you need to look at, are you passing urine more frequently? What does that mean? Do you need to go to the washroom every other 10 or 20 minutes? As you go to the washroom, are you feeling pain when passing urine? And this pain you have to quantify. Am I feeling pain at the beginning of passing urine, in the middle of passing urine, or when I finish passing urine? Is that the time that I have pain? Because that tells us where is the infection. If you feel the pain at the end of passing urine, then we know it's a bladder issue or higher up. But if you feel the pain as you start passing urine, then we know it's in the urethra, either the upper two-third or the lower third. So you have to be very specific when explaining to your doctor where the pain is. Okay. Then the third thing that we are going to check is, are you feeling pain on the lower abdomen? So especially above the pubic symphysis bone, which would be somewhere here. I'm sure I'm going to put an illustration here. So that kind of pain is called suprapubic pain. And it's pain that emanates around the bladder region. So that's something also very important for us to check. So do you have pain when passing urine? Do you have increased need to pass urine? And do you have pain around your lower abdomen region? The other one is, do you need to wake up at night to go pass urine? Or do you feel the urge to pass urine ever so often? So those are the things that you mainly see. Of course, a burning sensation. Pain can be this irritating or a burning sensation, especially the burning sensation tells us that you have a lower uterine tract infection. Now, if it is above the bladder, the symptoms are more non-specific. You may have, because now that is pain surrounding the kidney, there is pain surrounding the ureter. So that kind of pain will have fever, you may have chills, you may have, what is this thing called? You may have fever, you may have chills, you may have nausea, you may have vomiting, and then you may have very severe back pain and a crampy pain that is not leaving, especially if you have an infected kidney stone. So that's something that you have to be very aware of. Okay, so if you have pain that is non-specific coming from the back, coming to the front, or just at the lower back region, because the kidneys are situated behind, we call them retroperitoneal. So if you have that kind of pain, then it could be that you're having a kidney stone. It could be that that kidney stone is infected, or you have pus within that area of the kidney and the ureter. And that's how you would know that perhaps I have a urinary tract infection. There are those who have asymptomatic bacteriuria, which means that when you measure your urine, it is not showing, it's showing an infection. But when we ask you, you have no symptoms. So about 10% of the women have this particular type of picture, where when we test, we find that there's an infection. When we ask you, there are no symptoms. We'll talk about whether or not we need to manage, but definitely in pregnancy, it's important for us to check and manage. But in other situations, we'll discuss that. Oh, and something I forgot to talk about: catheter. Really, catheter is one of the most sure bet ways of getting an infection, because it picks the bacteria from the lower tract and pushes it up into the kidney. So no matter how aseptic we try to be, it is one of the most common causes of infections, especially in the older generation or post a procedure. And it's important for us to keep cleaning our catheters, and I'll explain to you how. So let's meet again as we now discuss management. How do we know that you have a urinary tract infection in the medical world? One, the investigations that we do to check whether you have an infection. The most common is something called a urinalysis, where you give your urine and then we use something that has a pH meter, and it enables us to know what kind of infection you have, but it just detects that there's an infection. Once we do that, now we do a urine MCS, which means we take that urine and subject it to microscopy, look under a microscope, and then we culture to see if we can grow any bacteria. And then sensitivity means we try and give medication on a test tube to see if the antibiotics we give are going to eliminate the bacteria. So it's the urine MCS. The other things that we do that can let us know whether you have an infection, especially higher up, we have radiological studies such as ultrasound, a KUB ultrasound. We have cystourography. Can also tell us whether you have infections or not, and what type of infections it is, and what could be the cause of those infections. So once we find the infection, the most definitive treatment for a urinary tract infection is to eliminate what caused the infections, most commonly using antibiotics. But based on your urine culture and based on the symptoms you're presenting, it will guide us on which antibiotic to give you and for how long to administer it for. how can you prevent urinary tract infections at home? 1. Drink a lot of water. 2. Do not stay with your urine for long. If you feel pressed, go to the washroom immediately. Having a full bladder for a long period is one of the causes of getting urinary tract infections. 3. If you can use cranberry juice, that's very good. It's a natural urine alkalinizer that can help you. 4. Whenever you feel any signs of an infection, kindly go to hospital. 5. Sexual intercourse is one of the causes of urinary tract infections. Therefore, if you can go and pass urine immediately after sexual intercourse, then you can prevent exacerbating infections or getting infections to begin with. So these are some of the things that I would recommend personally when you're at home. As for catheterization, how can you prevent your older mom or dad or whoever may be having a long-standing indwelling catheter? 1, we need to do cultures for that. We need to do periodic cultures for the catheter, for the urine coming out of the catheter, especially if they have to stay with it for long. For example, someone with prostatic swelling or BPH, benign prostatic hyperplasia, who we know would have to stay with a catheter for long because of continuous retention. So such people, let's test the urine regularly. Let's drink a lot of water to kind of flush out the catheter. Okay. 3, it needs to be changed either 1 week or every 2 weeks, depending on the type of catheter that you have. Silicone-based catheters can stay a bit longer before they start giving you infection signs. Then you need to be covered for antibiotics if any signs of infections can come. And especially for those who have issues of dementia, they may not be able to tell you that this is the source of pain. And you just notice that they get to us and they get to us all diabetes mellitus. So one thing, if you notice that and they have a catheter, start thinking, could this catheter be giving the infection? And if that be the case, could it be changed and have a fresh one put in to help them with voiding urine? If you can avoid altogether, sometimes people prefer to go the route of using diapers. Well and good, but at the same time, those also need to be changed frequently. So I hope this has helped someone. Thank you so much. Let's meet you next time for our next episode of Wheels for Life by Dr. Jemimah. Thank you.
Life is busy and sometimes health concerns can't wait. With Wheels for Life, healthcare is just a tap away, anytime, anywhere. Whether it's a fever, a routine checkup, or something urgent, Wheels for Life connects you with licensed doctors in minutes. Get expert care from trusted doctors, specialists, and counselors without leaving your home. From prescriptions to follow-ups, Wheels for Life helps you manage your health on your schedule. With Wheels for Life, healthcare is no longer a hassle. It's fast, secure, and always within reach. Download Wheels for Life app from Apple Store or Google Play Store today. Wheels for Life, fast, convenient, and secure healthcare in the palm of your hand.